to 48 hours after our session on the Rutgers Project Echo COVID-19 website. The website will also include the links and resources that are shared today, as well as the recording of our session. Finally, I need to let you know that as the timeliness of this content changes with each passing day, if you are viewing this recording at a later time, realize that this may not be the most current information at the time you are viewing it. Note that the information and websites that are important resources regarding this subject include the New Jersey Department of Health, the CDC, and covid19.nj.gov. Our presenters for today's session will be Ms. Jennifer Fearon, Policy Advisor of the Office of Policy and Legislative Services, and Ms. Amanda Medina Forrester, Executive Director of the Office of Minority and Multicultural Health. Thank you both for being here and during such a busy time for the Department of Health. I know that I speak on behalf of all of those who are joining us today when I say thank you for connecting with our providers in this forum and for clarifying these logistical concerns that I think all providers are facing right now. Jennifer, you can unmute. Great.
Good morning, everyone, and thank you, Mary, for that kind introduction. We're so pleased to be with you today. Just to sort of level set about where we are, can we pull up the slides? So over the past 9 months now, New Jersey has been planning for the COVID-19 vaccination program, and we're just on the cusp of rolling it out. On the next page, please. Some of our key strategic aims in the work that we've done to date and the work ahead are to provide equitable access to all who live, work, or are educated in New Jersey, to achieve community protection, assuming the vaccine is effective, available, and that we have broad public uptake. And finally, to build sustainable trust in COVID-19 and other vaccines. Next slide, please. As I mentioned, over the past 9 months, we've been working to plan the vaccination program. And as Mary mentioned, we're so pleased that the Pfizer vaccine has been authorized under an emergency use authorization and that we will be able to begin vaccinating in the state tomorrow. We will be putting into action a vaccination plan that we worked on throughout the summer and into the fall. And we look forward to partnering with many of you in the rollout, both as consumers and providers of COVID-19 vaccines. Next slide, please. As Mary mentioned, the situation is rapidly evolving. What we know today is that a vaccine has been granted an emergency use authorization. This is the Pfizer product. Additionally, we know that the Moderna product will be evaluated over the next week or so, and we may have access to that vaccine as well as early as next week. We have in New Jersey a target of vaccinating 70% of the eligible adult population. And so this really is a whole of government, whole of state effort to meet those ambitious but attainable goals. What is likely is that the vaccine will be allotted to in substantial amounts. However, at this time, we don't know the specific cadence of how much vaccine New Jersey will receive and on what timeline. We are really hopeful that there will be community protection, but again, those are unknowns at this moment. Looking forward to sifting through those unknowns in the days and weeks ahead. Next slide, please. As I mentioned, as you can see on the slide, we are right at the cusp of starting vaccine deployment in the state. The first doses will be administered starting tomorrow, and we expect that the Moderna vaccine will follow shortly thereafter. Now I'm going to turn it over to my colleague, Amanda Medina Forrester, to speak about who can expect to get vaccinated in these first weeks of the vaccine program. So next slide, please.
Hi, everyone. Good morning. And so I'll be talking a little bit about who can get vaccinated and when they can get vaccinated here in New Jersey. Next slide. So our priority groups have been established for the first phase 1A. The phase 1B, 1C, and 2 are still going through review through our ACIP, and of course our professional advisory committee. But to start right now, we are looking at healthcare workers, paid, unpaid, and long-term care residents. That happened Actually, it's going to start tomorrow, and then we'll start to move to phase 1B. Again, these phase 1B essential workers has not been established yet, but we will be moving that very fast. After 1B, or in simultaneous with 1B, there's 1C, and these are adults 65 and older, adults with high risk of comorbidities and other medical conditions. After we move from those three phases, we'll hit the phase 2, and that'll be general population. And again, just please note that phase 1B and 1C have not been established as of yet, but will be coming soon. Next slide. So who is considered a healthcare worker? So again, these are all paid and unpaid people who are volunteering and working in healthcare settings, who have direct or indirect contact with infections, persons, or materials. For instance, the typical would be the physician, the nurse, the pharmacist, dentist, or any licensed or registered health professionals. We're also looking at staff who are all ancillary within healthcare settings, such as those in food services, human resources, the scheduler, the receptionist, the interpreters, the laboratory. Also those in the community. So we're looking at healthcare workers will have first access. The promotoras, the home health aides, the visiting nurses, the doulas, and those who do see all patients. We also look at trainees, students, interns, essential caregivers, and vaccinating staff as also 1A. And then of course our other personnel like EMS, paramedics, funeral staff will be also 1A. Next slide. What is considered a healthcare setting? So I know we're getting a lot of questions about this. So this is just wanted to clear up that those who work at hospitals or volunteer at a hospital. Also, long-term care workers and volunteers and residents will also have first access to the vaccine, and other healthcare workers and volunteers. So again, it's hospital workers that work in a hospital. Long-term care facilities, for instance, include skilled nursing facilities, veterans homes, assisted living, and so forth. Other settings that are included in the healthcare index would be in ambulatory facilities, community health centers, dental, emergency medical services. So it's these workers that work in these settings are considered 1A. Next slide. So our next topic is, where can you get vaccinated? Next slide. So these are the types of points of dispensing that we will be administering throughout the state. So the first would be the closed pod, which would be a hospital, for instance. And of course, once those hospital employees get vaccinated and the hospital feels comfortable, it will be becoming an open pod. So for right now, the pod will be closed strictly to the employees to take care of them first, and then it'll be open up to other members of healthcare. And then you have, go ahead, Jennifer.
Yeah, I was just going to say, just to level set with the group, I know that you're probably hearing the term pod thrown around. That's point of dispensing. That's our term of art for anywhere where a vaccine is administered. As Amanda mentioned, we have limited doses at this moment, but we expect more to come. Phase 1A is a phase. It's not a day, it's not a week, it's a number of weeks. And so while all the sites that we talk about in this section might not be up and running today or this week, they will be coming in the days and weeks ahead. So just wanted to throw that in because I know that the terminology can be somewhat specific.
Mm-hmm. Thanks, Jennifer. So a type of pod, points of dispensing, could be static, just like a hospital. You know, it's a brick and mortar. People could get vaccinated as employees, or it could be a mobile site. Some federally qualified health centers have these mobile units that could be also the potential vaccinating mobile units. So those are an example of the type. Funding, one could be government-led. For instance, if we want to establish here at the state, establish a pod, that would be through us, or it could be through a private entity. Another access, we're looking at drive-through pods, walk-up pods, and then the drive-up pods. That again is still in development. So until those pieces are released, we'll definitely share with you. And then of course, you know, we're looking at the throughput. We're always looking at how high vaccines could be administered throughout the week, and how many doses per vaccinator. So that's called the high throughput. And then of course, we're looking at a lower throughput. So what sites can be a lower throughput and with those resources that they currently have. So again, these are the terminologies that we're using at Department of Health to ensure that everybody has access to the vaccine, multiple ways, multiple channels. Next slide. Jana, is this yours?
Yes, I think this one's in my court. So in terms of our initial points of dispensing, as I said, this is going to scale up over time. So this week, you'll see that the first sites across the state will be some acute care hospitals, because they are able to readily and effectively handle and deploy the Pfizer vaccine, which comes in allotments of 975 doses and requires ultra cold chain. We know that over the next weeks, especially if the Moderna vaccine product comes online, we'll have more vaccine available in the state, but also multiple products with multiple different storage and handling requirements and allotments of doses. So we'll be able to expand the types of venues where vaccine can be provided in the state. So over the next 2 months, the types of pods that you can expect to be launched include mega sites. This is our term of art for sites that have a very high throughput. So lots of vaccinators, so that lots of people can be served simultaneously, as well as acute care hospitals, university sites, pharmacies, both the pharmacy is CVS and Walgreens, which will be helping us serve our long-term care settings, as well as other chain pharmacies to serve other long-term settings that cannot be served by CVS and Walgreens. We're also working to partner with some urgent cares, federally qualified health centers, and local health departments. Across these types of sites, it'll be common practices in terms of their capacity to register, vaccinate, bill, ensure vaccine stewardship, and certainly report on vaccination. This is an evolving list. This will, in no way will this be a static thing, and will certainly be changing to week to week as we move into the new year, and as vaccine availability evolves in the state. Next slide, please. So to those of you who are healthcare providers on this webinar who might be interested in hosting a point of dispensing, there is a process to become a point of dispensing. As I said, like the vaccine is very limited at this time. We only expect 76,000 doses this week. However, we have about 950,000 healthcare workers and long-term care residents in phase 1A. So this is going to take some time. It's going to take a lot of collective action. So if you are interested in hosting a point of dispensing, there is a pre-registration process for us to be able to evaluate the best sort of match of supply and demand of vaccinators with the public that needs to be served. Next slide, please. And now I'm going to turn it back over to Amanda to speak about where you can expect it as a consumer.
Yeah, so the vaccines are expected to be available to all healthcare workers starting mid-December 2020. Again, that is moving really fast right now. We just, like Jennifer said, we're getting our first shipments in. So for hospital workers and volunteers, long-term care workers, volunteers, and their residents, and all healthcare workers. These are the three that we're focused on right now. So where can you get vaccinated if you are a healthcare worker? If you work in a hospital, that's where it'll be your first, that'll be your pod, your points of dispensing. Hospitals is where you work and volunteer, is where you'll have first access to the vaccine. If you are a worker, resident, or volunteer at a long-term care facility, that's another place that you'll get vaccinated if you choose to. And then of course, if you're not a healthcare worker, the points of dispensing, like I was mentioned earlier, would be pharmacies, urgent care centers, other medical clinics, FQHCs, hospitals, or local public health departments, and other state and county run sites. So there are, of course, we want to make sure that everybody has access. So hospital, long-term care facility, and healthcare workers outside a facility would have access through these areas. Next slide. So how can you get vaccinated? Next slide. So we are developing 4 channels of access to everybody to get vaccinated. Our first channel of information would be public awareness campaign. We want to ensure that everybody understands and knows how to get access to the vaccine. The first line would be the public awareness pieces that we're developing right now. The second line would be through your employer or an organization. This employer and organization will help you, will give you information on how to sign up, updated, factual, effective, relevant information about the vaccine, side effects, and all that information that we send out from CDC from us to you. The third channel would be encountering a walk-up site or a pod. So if a walk-up site or a pod is at your area, your vicinity, that's a place you could go to that site and register and schedule your vaccine. The fourth is something that we're currently developing. We're developing an ambassador program, and this would be a door-to-door or phone-to-phone or virtual-to-virtual connection with all our community networks. And these networks will be the information gatekeepers to ensure that residents have access to the vaccine, where the closest pod is, and how to register and schedule your appointment. The consumer has these channels for self-registering as well. We're developing a website with a portal that anybody could easily use. It'll be super easy to use, just to log in and schedule your first appointment. We're also building a call center, and this call center will have thousands of agents ready to answer any questions and help the consumer navigate through a system, a scheduling system. The walk-up sites will be the same situation, just in person. So if you want to be a walk-up site just to give somebody information about the vaccine, how to access the vaccine, how to schedule the vaccine, this is something that we're looking to our stakeholders, our gatekeepers to become walk-up sites as well. Of course, our pods will also be considered walk-up sites. You go in and you register and schedule. And then of course, the door-to-door ambassadors. But these are the 4 main channels that we're trying to reach all consumers in an equitable fashion. Next slide. So you could see as we're building up all the systems in place, we are setting up the site. In this site, we're going to set up lanes and scheduling for slots, slots for scheduling, my apologies. Manage our inventory. This is something that the pods team will be doing, managing inventory. Do we have enough PPE? Do we have enough vaccines? Do we have enough vials? All that information. We'll be checking in the recipients. The vaccinator will administer the vaccine, and then of course provide second dose reminders. Sorry. This is built right now through our NJVSS system. That's the New Jersey vaccine scheduling system. It's still in development, but should be coming out really soon. There's some really good benefits to using our NJVSS system. It's a streamlining process to identify and scheduling the vaccine through the site if you choose. It's an easy platform to use. It is going to be accessible to all individuals in different languages as well. And who are, of course, also register them through this platform will be easy for a second dose reminder piece. At DOH, we're able to track and look at that individual to make sure that they have information about the second dose, if they have any side effects, information about where to go if you have side effects, and just overall general vaccine information. With this centralized tool through this NJVSS, it's allowing us to look at appointment scheduling, automatic reminders, streamlined contactless recipient check-ins, and of course, a lot of other pieces that it would be more internal than public. It also helps the state identify who is getting vaccinated, who's not, and to ensure that our critical populations have access to the vaccine. Some considerations though, right now, it is temporarily dual entry and may be required with an existing EHR system. So right now, DOH is developing an integration with the internal and external EMR systems. And then of course, staff training of properly using the system will be required. Of course, again, we're going back to those channels, a call center, ambassador program, and all the other pieces that make this work will be definitely being built right now as we go. Next slide. So this is just the public confidence pieces that we have kind of been using, and they're all kind of fitting in a nice puzzle. So as of right now, our Commissioner of Health has been holding over 3,000 stakeholder engagement calls across the state with our federal, state, and local leaders, our healthcare providers, professional associations. So she gives high-level information about the vaccine, what's coming, what we're expected to do, and then a call for action. We're also doing a multi-pronged public awareness campaign that will be launched in really soon in regards to the vaccine, the availability, access, side effects, anything that the consumer wants to know about. We will definitely be as transparent as we are with our CDC partners. The vaccine website is being updated consistently and constantly through our CDC information and guidance. And we also have a provider survey that we're getting a lot of great information about. And this survey helps us adopt new strategies on what the providers are asking for, what information they're requesting. And this is how we tailor that information to those providers. We also been having listening sessions. So as of today, I believe we had 14 listening sessions hosted to check on attitudes, perceptions of the vaccine through the consumers and healthcare employees end. We want to make sure that we are hearing their thoughts, whether we're hearing their fears or concerns, and then finding what strategies work for them, to what information they need to educate themselves on the vaccine. And then of course we have our weekly newsletter. That's something that was launched December 4th. And this is just to keep our stakeholders up to breast of what's happening with the vaccine, what changes have been made, what developments are being done. And then of course, just being transparent on any concerns that we have. Next slide. I think Jen, this is yours.
Yes, so as part of that initiative to try to be as transparent and clear and up to date as possible, the Department of Health has launched Vax Matters, which is our weekly newsletter around vaccine information. This is the latest about what we're doing in our implementation of the vaccine program. We encourage you all to subscribe to follow along with the latest updates. Next slide, please. In addition, there are loads of resources that we are trying to deploy on our website to make information as readily available to providers and consumers as possible. Among other things, you can read our whole vaccination plan, as well as some of the key safety and storage and administration recommendations of our federal partners. Next slide, please. Now, with vaccines coming tomorrow, what are some things you could do starting today? First off, we encourage all of you, thank you for coming to today's webinar. This is part of the effort to share information, and we hope that you will continue to seek knowledge and stay informed. Please continue to follow the latest from the press conferences that Governor Murphy and Commissioner Persicelli deliver almost daily, as well as certainly the information that we're publishing online and social media, etc. If you are a healthcare provider that is equipped to host a point of dispensing, especially if you are willing to host, to vaccinate not just your own personnel, but the broader array of healthcare workers out in the community, we encourage you to come forward and volunteer as a point of dispensing. No matter whether it's counseling your patients, talking to your families, speaking to the broader community, or all of the above, we appreciate any work that you can do to help us build public confidence. As Amanda so eloquently put it, like, this has been such a priority for the state, because we know that this is that's where the rubber meets the road. Likewise, as healthcare personnel in the audience, we know that you are such trusted voices in your communities. So to the extent that you can serve as community ambassadors, we really value that time and energy. And of course, finally, we hope that you all stay safe, stay healthy, and next slide. We hope that you too will get vaccinated in the days and weeks ahead. Thank you so much for having us. We welcome any questions that we can address. Thank you.
Thank you so much, Jennifer and Amanda. Such important information. I know as a pharmacist immunizer, I can't wait to complete my hands-on training later this week and jump in and assist as well. So thank you again for sharing this. We've had a number of questions come in, so I'm hoping between the two of you, I realize that this is an evolving area. So if the answer is not known yet, I mean, if there's a way we can follow up or maybe develop an FAQ on this subject, I think it would be really valuable. But one of the questions I'm seeing again and again, either from the chat or pre-submitted, was, can you maybe re-explain how our healthcare providers who aren't associated with a hospital, but who have direct face-to-face patient interaction, whether it's a physical therapist, an occupational therapist, our physicians, nurse practitioners who are in the community setting, but not necessarily hospital affiliated, how can they get the vaccine, and what's the timeline that we can expect for these professionals or providers?
Yeah, so I'll take I could start, and Amanda, feel free to jump in. So first off, we know that so many of our healthcare workers are not based in a hospital setting. So that is certainly top of mind for how to serve our diverse healthcare workforce. We know there are home health aides that are in consumers' homes. We know that there are paramedics and EMTs who aren't so much associated with the facility as going between healthcare facilities. We know that there are small private practices and others, and all of which have that direct sort of patient exposure and exposure to infectious persons or materials. So with that is why we'll be launching over the next week or so this statewide New Jersey vaccine scheduling system. We hope to use that as a mechanism to help consumers locate points of dispensing. And we are working with our points of dispensing to ensure as many of them as possible will be able to serve that broader community of healthcare workers in phase 1A. As I mentioned, phase 1A is a phase, it's not a day. We're hoping that based on vaccine availability and our ability to open pods across the state, that we'll be able to serve healthcare workers, that access will be made available by the end of January. But again, there's so many unknowns about how much vaccine we're going to get at what frequency, and how quickly we'll be able to sort of mobilize people. And quite frankly, a piece of it comes down to how many healthcare workers wish to be vaccinated at this time. And so the timelines are fuzzy, but we just know that it is top of mind for us to serve not just those who are based in facilities, but those who are outside of facilities. And just to put a fine point on it, when we talk about healthcare workers, we are not just talking about licensed professionals. We are talking about the receptionist, the janitor, the clinical care supervisor who might not, who has that, it is about exposure to infectious persons or materials. It's about being in a setting where healthcare is provided. So it really is an expansive definition. So we know that has dual things. First off, it means that really a lot of people in New Jersey will have access within the first month or so, but also a lot of people will have access within the first or so. This is going to take some time. And so please bear with us as we try to deploy vaccines as quickly and equitably as possible.
Thank you. And I think that raises addresses at least a lot of the questions that we've received. Amanda, you mentioned this public awareness campaign and employer communications. I'm wondering how individuals will be notified that vaccine is available for them. So how will individuals be notified about eligibility?
No, that's a great question. So through the employer system, we're asking all employers, and this will be going out fairly soon, earlier this week, all employers to share with their employees how to access the vaccine. So the system is getting built, the NJBISS system, which should be built this week. And so employers will be sharing that information to the employees. Letters should be going out through the Department of Labor fairly soon, and then all our state points of contact as well. So we are asking all our state agencies, our sister state agencies who have been just phenomenal working with us to ensure that all information about the vaccine and access to the vaccine is going to get released to the employees. So that's going to be one. The campaign, of course, is going to be another way. The media campaign vendor is working very closely with our communications department to make sure that there is very specific messaging for healthcare workers as well. And then, of course, you know, through online, we're using social media, our Facebook, Twitter, our Department of Health website, our COVID-19 website, our app. So any information through those systems, through those social media is also going to be given out as well.
Excellent. And, you know, maybe perhaps for both of you to weigh in on, we've received lots of questions regarding phase 1A eligibility. And as you were speaking and sort of reviewing, I think you had a really neat graphic slide that explained who falls into this phase 1A. But we had some specific cases. So maybe if between the two of you, you could sort of shed some light. One of the questions that came in was regarding the Department of Corrections and our prison staff, particularly our university behavioral health group. Are those individuals considered phase 1A as a priority?
Yes. So in terms of the healthcare personnel who are in the correctional institutions, of course they are healthcare personnel. They would be counting phase 1A under that definition. Additionally, the other portion of phase 1A, as Amanda has shared, are individuals residing in long-term care. And so that also is defined fairly broadly to include anyone who is in a setting where they can't live independently and for which additional medical support is necessitated. Given the vulnerability of the corrections institutions in the state, we have been thinking about how to best serve our correctional institutions as rapidly as we can, as well as all of our other long-term care facilities. When you look, when you define long-term care expansively, there are thousands and thousands of places that will fall into that definition. Again, phase 1A is a phase, it's not a day. We are hoping to start with our skilled nursing facilities towards the end of the month or in early January. We're still working with our vendor, CVS and Walgreens, to figure out when we can start, and we're hoping to start as soon as possible. But certainly, like as we progress through different congregate settings, we will be serving a variety of long-term congregate settings.
Sure. So it sounds like our psychiatric hospitals and psychiatric hospital staff might fall under that umbrella as well then.
Correct. So as we move forward over the next weeks and months, certainly we will be, this is where, to Amanda's point about how we have both static sites and mobile sites, like this is where mobile sites really come into play. For congregate settings where individuals can't, quite frankly, ambulate to a pod, that is where we are working to identify appropriate partners who will be able to serve as mobile sites to serve within those congregate settings. And again, this is going to take some time, but that's currently what we are working towards. So certainly we're looking for the appropriate partners to serve our psychiatric hospitals, our other sort of congregate settings, our IDD homes, our other group homes, et cetera. So yeah, it's lots of work ahead. Please be patient with us, but know that it is top of mind for us.
Great. Two other questions, just while we're on this sort of vein of you know, phase 1A eligibility. Are dialysis centers sort of on that list in 1A?
Yes, yes, Mary, they are. So those healthcare workers will be taken care of as well.
And then the other group we've received quite a number of questions from has been our school nurses, just to clarify their eligibility.
So school nurses definitely are 1A as well. School teachers and other personnel, they're having discussions on 1B. So they would fall, if that is approved through ASIP and through our PAC, that would be 1B. But for right now, school nurses are 1A.
Great.
Mhm.
I know part of the strategic rollout associated with the distribution plan has been really quite an extensive discussion regarding equitability in the vaccine distribution process. I was just curious if you can elaborate a little bit about how will distribution amongst healthcare professionals, how will that be triaged? Will level of risk, we're talking about a whole number of different groups and types of facilities at this point, but how will the level of risk of exposure be considered in determining who is in fact eligible and when?
Yeah, certainly. That's something that, so in New Jersey, we have a professional advisory committee. This is a combination of ethicists and healthcare professionals and other experts in the fields of public health, quality, um, and that group has been working throughout the pandemic to advise the department on best practices around these ethical decision making. So they've informed a number of sort of key ethical decisions that the department has had to make. That body has been reviewing the ACIP recommendations. So ACIP is the Advisory Committee on Immunization Practices. That is the advisory committee for CDC. ACIP, I guess, almost a week and a half ago now, days are all blending together, apologies if I'm completely off base on the timeline, had made recommendations about how to define phase 1A. So New Jersey's definition of phase 1A is taken from the Advisory Committee on Immunization Practices. So that's defining it as both individuals who are healthcare personnel as well as residents of long-term care settings. Within those populations, that's where we have been reviewing through our professional advisory committee the appropriate way to triage, for lack of a better term, given, as you said, Mary, there's scarce doses and as we believe, more demand than doses time. Last week, we issued from the department a memo to our hospitals, which will be starting to vaccinate this week, advising them about how they should prioritize in instances of scarcity, specifically to focus on those personnel who are at highest risk of exposure. So those who are perhaps seeing COVID unknown patients versus those who have known positives or known negatives. We know that there's different parts of a hospital, different parts of other healthcare settings where your potential of encountering a COVID unknown patient is higher than others, for instance, in our emergency rooms. So that's been the guidance to our hospitals about how to prioritize, and similar prioritization guidance will be issued to other settings as well. That's why also as a consumer, when you are scheduled, you may be asked some supplemental sort of eligibility questions, not to screen out, but to screen when, because it's a matter of when, not if, that vaccine will be made available to you. So for instance, we may ask questions that would assess whether you might fit into that highest risk category. Again, this will fluctuate based off of vaccine availability, and certainly we want to serve as many people as quickly as possible. So this will be an evolving sort of situation in the days and weeks ahead.
And Jennifer, along that line, how will the Department of Health be assuring that there are the two doses that are available? We're hearing, at least regarding Pfizer and Moderna, that it will be a 2-dose series. So, will you encourage facilities to hold that second dose to ensure that it can be administered, or what strategies are being used in this regard?
Yeah, so I can speak to this a bit, and then Amanda, if she can speak to some of the other pieces. First off, in terms of when facilities will receive that second dose, the way that the federal government has structured the program is that the first doses are sent out and then the second doses are held back. So until the point in time when that first dose has been administered, they will not send the second dose. This is in the interest only of safety and proper storage and handling of the vaccine, as well as in making sure that doses are administered before saddling a facility with loads and loads of doses. So with that, the federal government will be shipping to the same facilities the second dose at the appropriate interval. As you mentioned, both the Pfizer and Moderna products have a 2-dose series. For Pfizer, I believe it's 21 days apart, and for Moderna, I believe it's 28 days apart. So when we speak about 76,000 doses available in the state this week, those are 76,000 first doses. So 76,000 individuals who could be served. And so that's on the provider side. On the consumer side, we're working on a number of mechanisms to provide second dose reminders to ensure that individuals come back. And this is where our healthcare partners will be such valued partners in that effort. Amanda, do you want to speak a little bit about that?
Yeah, so for those open pods, those pods that are going to be more for the consumers, we'll be relying heavily on a playbook that's being developed right now to ensure that we have the mechanism for a second dose. We're going to be learning a lot from the providers themselves who already know how to vaccinate with 2 doses. The HPV, for instance, the HPV vaccine is a 2-dose. So that's something that we've learned a lot through our vaccine preventable disease program here at Department of Health, and also our experts out in the field to do the 2-dose piece. Because again, it's logistics is everything right now. Operationalizing everything for a 2-dose is double the work than just 1 dose, like the flu shot. So we need to ensure that we are learning from those providers that know how to do a 2-dose vaccine system. And then we built that into the open pods.
Right.
Yeah, and just with that, just in terms of some of the strategies that we hope that points of dispensing will be deploying. First off, strategic scheduling. So thinking about ensuring that if someone's scheduled for 5 p.m. on a Friday for their first dose, then 21 days later that they can come back at 5 p.m. on a Friday for their second dose, because we know that people's schedules, maybe not in the healthcare workforce, but in the broader population, can be somewhat consistent. And so we're trying to meet consumers where they are. Also, when a person receives their first vaccine, they will be given a vaccination card that will record that as a hard copy so that they have this record. We hope that will help people, one, know that there's a second card and that there's a second dose needed, but also remind people of when they received that first dose. Additionally, everyone who participates in vaccination will be part of our New Jersey Immunization Information System, NJIAS, which is our state's registry, so that we can account for which vaccine someone received. We know that our vaccine administrators are concerned about if someone receives, for instance, the Pfizer vaccine and then comes back and wants the Moderna vaccine, this way, we would be able to make sure that the same person received the same vaccine product at the right interval through that registry system. We also intend that our pods will either be Pfizer sites or Moderna sites, at least in these initial stages, so that there isn't that confusion about which vaccine product a person received if there are multiple vaccines on the market. Certainly that may evolve over time, but at this point in time, that's our current thinking, to make it as easy for consumers as possible. And certainly to Amanda's point, lots of effort is being made to ensure that that we're leaving no stone unturned around second dose reminders. So we will continue at the state level speaking about the importance of returning for your second dose, but also look to our partners to encourage, if you're a primary care provider, even if you are not administering vaccines, to follow up with your patients about whether they have received their first vaccine, let alone their second vaccine. If you are hosting a pod, to use some of the tools that Amanda spoke to. And really it's an all hands on deck effort.
Sure. Really important tools, I think, that you've mentioned, Jennifer, with regards to ensuring, especially that second dose follow-up and again, receipt of the appropriate dose, which I know as professionals, those have been some concerns. Amanda, I think you addressed this, but will there be specific times when these vaccination clinics will be running or available via an appointment process or scheduling process?
No, unfortunately, Mary, we don't have specific times right now. I mean, our pods and logistics teams are working 24 hours a day, nonstop, weekends, solidifying pods, solidifying points of contact with mega sites. All these pieces are moving fast.
Sure.
And of course, it takes human resources, it takes money, it takes a lot of moving parts. So we are working really hard to get those up and running, hopefully by the beginning of January.
And maybe a little bit about what type of documentation should individuals who are going to become immunized, what type of documentation should healthcare professionals be prepared to bring with them or to upload when registering to receive a vaccine? Are we talking a verification card, a license documentation, a driver's license, insurance card? Can either of you sort of elaborate on that?
Yeah, I can speak to it a little, but again, this may evolve, and certainly individual points of dispensing may request additional items depending on how they are screening for those phase 1A, phase 1B, et cetera. To the extent possible, we hope that individuals will bring their insurance card because to the extent possible, we hope that our points of dispensing will be billing insurance. It should be at no cost to the consumer, but in order to get reimbursement for the cost of administration, we are hoping to bill insurance. For those who are uninsured, HRSA will be billed, the Health Services and Research Administration. They have an uncompensated care fund that will be billed for those who are uninsured. So again, you may be asked for your insurance. You will likely be asked for your insurance, but know that as a consumer, it probably will not be billed to you individually, or it will not be at a cost to you individually. There should not for the administration. In regards to other information you might be asked for, we are not, as far as the state is concerned, asking for any sort of proof of employment. We expect that people will self-attest to being within the appropriate phase, and be, we want to lower barriers as much as possible in terms of what is required in terms of documentation. That said, you may be asked some medical screening questions to establish whether you are appropriate for receiving the vaccine. We hope that everyone will review the EUA fact sheet, the emergency use authorization fact sheet for the vaccine that they will be receiving, so they can one, be aware of what's being provided to them, but also to know what some of the benefits and risks are of the individual vaccine product. So for instance, the Pfizer vaccine has only been authorized for individuals 16 and over. So those under 16 would be screened out in that medical screening process. There will also be the standard sort of data points that we collect as part of the immunization information system, so that we can, again, this goes back to that second dose accountability of wanting to have enough information that we can ensure that that Jane Doe is in fact Jane Doe when an individual comes back for their second dose. So items like your date of birth, your gender, your race or ethnicity, if you're willing to provide that information. We hope that the information will be readily provided by our consumers, and just know on ours end, we're working diligently to ensure that data is protected, and it's only used for those public health purposes that I've laid out.
Sure. Jennifer, is there a list of these pod sites available at this point in time? I know, what is it, COVID19.nj.gov is a plethora, really great resource, but are the pods listed?
Not yet, but coming soon. So this is where, at this point, like, vaccine is so very limited that we really, we're not able to schedule people broadly, but in the coming days, weeks, months, we'll be working to get that information shared through Vaccine Finder, as well as that is the purpose of the vaccine scheduling system that we've just spoken on, because we hope that will be sort of the consumer navigation tool to have an individual say, hey, I see that I am eligible. How do I find that point of dispensing and that specific slot that I can participate in? So again, this is all rolling out. If you happen to be based in a hospital, because those sites will start this week, those will start as closed pods. This is for one, to help us fortify our hospitals who have been so hard hit in the pandemic. Those are also sites where we certainly have a great number of healthcare providers who are at high risk of exposure to COVID-19 and to COVID unknown patients in particular. And so for this first week of the vaccine program, hospital-based professionals will be served. And so the hospitals will be managing and scheduling this week, but starting next week and into the future, there will be that larger sort of mass scheduling effort. individual pods may operate somewhat differently. For instance, some county level sites have already very well established scheduling processes from testing and from others, so they might be using their own sort of scheduling process. But again, this is an evolving process, and we will be sure to, as soon as that information is clear, share it with all of you.
I appreciate that. And I think you actually addressed this one question, but we had a question come in with regards to individuals who are providing care in group homes and state developmental centers. I just want to be clear that that group of providers falls into the 1A.
Yes. So those providers, if you're providing healthcare, you are a healthcare provider, and you are eligible for 1A. Additionally, our IDD homes, those have been, again, top of mind for us. Those would fall into those residents of long-term care settings. We're figuring out the appropriate way to serve those congregate settings. We know that some of those group homes range from just a handful of people to hundreds. And so there's great variability within that sort of category of settings. And so we are working to establish which vendors or which processes are the best ways to serve them. So certainly as we look into early 2021, that's when we hope to deploy mobile teams to congregate settings that will be served mobile teams. And just for sort of situational awareness, when we talk about going into a congregate setting with a mobile team, we hope that they will vaccinate everyone who comes into that facility. So from the residents of those facilities as well as the staff and personnel who serve them. When we talk about, for instance, our long-term care centers, when we talk about our skilled nursing facilities, we know that within skilled nursing facilities, there are both residents and staff, including the licensed professionals, the unlicensed staff, the contractors and consultants that come into the building, the essential caregivers that come in to provide essential services. All of those we hope to serve within those mobile points of dispensing.
And I know we have another session coming up next Monday where we'll really sort of explore this whole rollout for our long-term care population as well. So I think really good point.
Yes.
Let me ask you, as we sort of begin to wrap up, how can a properly credentialed healthcare professional volunteer to help with this rollout effort, to help as immunizers? Is there a mechanism in place, or will there be, where individuals who may be retired or just want to help can get involved?
Yeah, we are so thrilled with the number of healthcare workers that have come forward to raise their hands. Certainly this will be needed as we get into 2021, and the number of sites and the amount of vaccine metastasizes, for lack of a better term. So certainly if you are a retiree, you can work through the Division of Consumer Affairs to get your license reactivated. So just know that would be the first step for anyone who is retired who wants to participate. For anyone with an active license who has the capacity to administer vaccines, as well as those who might be interested in staffing a pod, there's many unskilled, unlicensed roles. For instance, the data entry, the greeter, et cetera. We're working on a process to streamline that. We know that we have to match sort of supply and demand for staffing. And so we'll be working with some staffing agencies for some of our larger sites, but also looking to work through our medical reserve corps at the county levels to help connect individuals with who are interested with those needs for staffing. Again, this is evolving at this point in time. We know that our points of dispensing are well equipped, but it's going to continue to evolve in the weeks ahead. And again, just so grateful to anyone who has the time, energy, and capacity to volunteer. I know especially our local health departments are already starting to recruit from the Medical Reserve Corps to staff their sites.
So reaching out to your community Medical Reserve Corps may be appropriate, provided you've got an active license.
Yes, that would definitely be my recommendation at this moment in terms of like a first point of entry. And again, this will, sure, as we see how much need there is for staffing, we'll be looking to deploy additional mechanisms.
And Jennifer, you made a message, or you made a point in your presentation to be a vaccine ambassador. So we had a question come in. What does that mean? How can we be advocates? How can, we sort of dispel some of the hesitancy and some of the some of the things that are circulating online that we know to be erroneous or incorrect? How can we really be ambassadors for the Department of Health and help you accomplish your mission with vaccine rollout?
Yeah, I could take that. So the ambassador program is something new that we are learning from other states. And so this is what happened with testing. We didn't have enough boots on the ground, enough those true community educators to really let people know that social distancing, wearing a mask, all these mitigation strategies that we need are so incredibly important in addition to the vaccine. So we are doing a call to action for a vaccine education ambassador. So it's not just purely for the vaccine, but it's for all mitigation strategies that we need, because not everybody's going to get vaccinated, right? So we still need to be protecting ourselves and our families and our loved ones. And so for the ambassador program, as we're starting to roll out, we haven't started recruiting anybody officially, but if there's anybody here on the call that is interested to learn more or join me to build this group of ambassadors, these boots on the ground people who live it and just want to embrace and educate their communities, please reach out to me. And then I will definitely bring them into this, and we will do it all together collectively.
Yeah, and I think in addition to those more formalized ambassador program, which Amanda is so brilliantly putting together with across the state, we also hope that as you speak with your patients, that you consult some of the materials that we're posting on our website. As was said earlier, we're launching sort of a statewide communications campaign, and with that, we're hoping to deploy sort of a toolkit for providers and for community members and for lay people to use in conversations with their loved ones, their trusted family members about why to consider a COVID-19 vaccine. So more to come. Again, just we hope that you'll continue to share factual and up-to-date information with your networks.
Thanks so much, Jennifer. And just to be clear, as we sort of wrap up, will the information regarding which professionals fall into that 1A categorization, will that be available on the state website, or is there a resource where individuals can turn to for that information?
Yeah, so we're trying to deploy more information in the days ahead. So we're putting together some FAQs and other resources. So as those become available, we'll be sure to share those. Thank you.
And I also believe the Vax Matters newsletter has all that information too. Examples of who is a healthcare worker, where do you work, as a point of identifies you as a healthcare worker. So using that as your first line of communication, education to your employees is crucial. So that will also, and then of course that's also on our website.
Great.
Yeah, we really see the Vax Matters newsletter as like the quick snapshot of the key information that you need to know this week.
Excellent. And I think, what we can do from the Rutgers side is to try to get that link up and be able to share that as well. Let's see, as we sort of begin to wrap up, let's see, I think really this might be a good point. We have quite a number of questions that have begun to trickle in with regard to vaccine efficacy and vaccine safety concerns. I think that we will continue this conversation as the information evolves and as we kind of get the data out from ACIP, and we know the FDA will be convening a specialty panel again later this week to review additional data from Moderna. I think, if anyone who's joining us and still interested, we'll be talking a little bit more about what to expect when you become vaccinated this Friday. So we'll continue the conversation with regards to the clinical effects of the vaccine and how we can sort of educate on those concerns. It'll be Friday, December 18th at 11:15, and we certainly hope anyone who that will be pertinent for will join us during that time. But I really appreciate Jennifer and Amanda, such important information, such a really good information to be aware of with regards to the evolution of our our pods and our distribution process. And I think you've really clarified so many of the questions we've received with regards to eligibility in this phase 1A rollout. So we know that you're both extremely busy, and we know everyone on the line is so busy as well. So we just want to, really thank everyone who's been able to attend and participate in today's session. We've recorded this information, so not only the slides, but also our extended question and answer period. So those certainly will be available as a resource after today's call. But I think with that, we'll give everybody back just a few minutes of their time. So thank you again so much. Thank you for joining us, and we hope to continue the conversation later this week. Thanks, everyone.
Thank you so much.
Thank you.